So if you're gonna knock, come in, wash your hands, close the curtain. Hello, my name is Ashley. I'm gonna be your nurse today. Can you verify your name and date of birth?
Katrina Howell, 4/25/72.
Can I see your wristband, please? Okay. So today I'm gonna be doing a cardiac and respiratory assessment, and then we're gonna go over some things. Okay. So the first thing I'm gonna do is your respiratory assessment. Is that okay with you?
Yes, ma'am.
Alright, so you're gonna find your first intercostal space and then go down to the second one, and this will be your aortic area. Then you're gonna slide over to the pulmonary area, and it's on the then you slide down to the third intercostal space. This is the Herb's point. Then you're going to go to the fourth intercostal space. Alright, and then we're going down to the fifth intercostal space and finding the mid-clavicular line, and you're going to meet with those two. This will be done on the skin. This is the mitral valve. Okay. The next thing I'm going to do, is you'll turn it around to the bell and go through those points again, and I will check for any low pitch sounds, and that is how you detect for a murmur. So the next thing I'm going to do is check you for edema. Can you hold out your arm? You do this by pushing on the client's skin, and if there's any indentions, that could be a sign of edema. You'll check this excuse me. You'll check that bilaterally from the most distal point, and you do it on the legs too. I need you to show what I'm doing, please. Alright, so you push on the leg. And she shows no signs of edema. So the next thing that we're going to do is check your respiratory. So I'm going to listen to the sound of your lungs. You'll always start on the left side of the patient, but for her, this would be her right upper lobe. Take a deep breath. Breathe out. And then you'll go over to the right side, but this is her left upper lobe. Deep breath. And then moving down to the left lower lobe. Breathe. Then moving on to the right middle lobe. Breathe in. Then while you're here, we're going to go around and check the right lower lobe. Breathe in. Breathe out. Then we're going to go and check the left lower lobe. Breathe out. Okay. Can you lean forward a little bit? So we're going to start on the left side again. This will be the left upper lobe. Breathe in. And the right upper lobe. And then the right lower lobe. And we're going to do the left lower lobe. Okay? Her breathing sounds clear, no signs of wheezing. So the next thing we're going to do is go through all of the points where you can locate a pulse. So you're going to check the radial pulse, which is going to be on the thumb side. Okay, so she had 20 within 15 seconds. You can multiply that by 4, and that'll give you 80, so it's 80 beats per minute. And then the next thing that we're going to do is check the other side, because you have to check these pulses bilaterally. Okay, and then you'll do the brachial pulse. Come over here and check this one. Okay. There's no deficit within our pulses. The next pulse that you can find would be in the armpit. It's the axillary point. And then we're going to check your carotid. You never want to check both of these at the same time because it'll cut off blood flow and the patient will pass out. Want to check this other side? Over here. Okay, so while we're here around the neck, we're going to check for JVD. Can you hold your head back at 45 for me? Look to the left. Look to the right. She has no signs of JVD because if you saw that, you would see a large vein within the neck. So we're going to come down to her feet now, and these are going to be the pulses on the feet. Hold your feet still, please. Okay, so the first one is the dorsalis pedis, and that's going to be on the top of the foot. You see my heart beating. And then you'll check it on our other foot. And the next one is going to be the posterior tibial, and that's going to be on the outer side of the ankle. And all of her pulses are ranging from 20 beats every 15 or within a 15-second interval, so they're all around the same. All right, and then next you're going to go to the popliteal pulse. That's going to be behind the knee, and then you'll do the femoral pulse that's within the crease of your groin area. Okay. So with the respirations, going back to that, what we like to do is to tell COVID coming around and being as bad as it is, we'd like for our patients to practice coughing and deep breathing, and you'll do that 10 times every hour, every waking hour. So you'll breathe in, hold it for 5 to 10 seconds, turn, and cough. There you go. And that helps to expand your lungs. The next part of our assessment is a safety measure. Have you fallen within the past 3 months at any point in time? No. Okay. Are you experiencing any pain today? No. Alrighty, well, you've been a lovely patient. Thank you very much.